So Adam, how was your week?
Busy. Between patients and currently doing a renovation at the new practice, it's been lots of fun, lots of planning, and then balancing home life as well has been interesting. The little one was unwell last week. He's just turning around the corner now, is getting better. Wife said she's got a bit of a scratchy throat, but we're ignoring that and we're just sort of focusing on trying to get to the weekend, or get to the beginning of the following week, as quickly as we can. So yeah, it's good fun. How about you?
I've had quite a good week. I've done a lot of running. Is most of my week, and had a good sedation case on Wednesday. Felt more confident, I think, being in charge of the room as the sedationist. So that was sort of probably the highlight of my week there.
So how many cases being mentored until you've kind of been left to head the case up?
So this was case number 5. And yeah, so last time I was doing more. This was, I felt more that I was the sedationist, with Chris sort of in the corner. But no, it was good. Still, I think I still need to work sort of on really having that presence and making sure ready to sort of step in and be like, I am in charge. Like, Ali, put down your instruments. Like, I need to sort this out.
Get out of the way.
Get out of the way. But yeah, it's coming, and I'm really enjoying it, and that's the main thing.
Good.
But
I have to say, no, you did a really good job, because it's really hard sometimes if we're doing a long treatment like a full arch and the patient is over sedated, it's a bit of a nightmare for them and for us. And it went really nicely. Yeah.
Thank you. So Ali, how was your week?
Good week, busy week, really good things happening. So the case you talked about, it's the first time we've used our fully digital workflow, which means that thanks to a guy called David O'Dowling in Australia, he's a dentist, and I have to give him a shout out. I don't know if he listens or not, but he very generously showed us how to use CT scans to match up the pre-op and post-op for full arch patients. Now, all your intraoral markers are gone. You've changed the bone, you've changed the teeth, and he knows how to do this. And what he said is, just send me the case, I'll screen record me doing it, and I'll send it back to you. And he did that, and he taught us how to do this. So that was the first case we've done with no extra markers. And extra markers is extra faffing, extra cost, extra inaccuracy built in. So that was awesome. I absolutely love that. And then we also launched cohort 2 of the site-specific course, which we've talked about before. So there's a couple of spaces remaining, but we were blown away by the demand for that. The waiting list has pretty much taken it up, which is amazing. And we're about to launch our full arch course, and that's a digital full arch course. So I think I can say now, because we're about to launch it, but it's going to be, we're going to get the CBCTs of cadavers beforehand, 3D print the cadaver's jaws. So day 1 we'll be planning and performing surgery on the printed jaws. Day 2 we'll be doing the surgery on the actual cadaver, and we're going to design and 3D print teeth there and then, and we're going to load the cadavers. So
I don't know how lucky they are.
yeah, no, I just think the future's here. It's amazing. And then just to cap it off, which was really nice, I got invited to have an associate fellowship with the College of General Dentistry.
Oh wow!
Yeah, so that's the first time I've been invited to have extra letters after my name, which is always fun. So thank you. It's, by the way, if anyone's listening, I think if you have your MJDF or MFDS and you have a master's, you pretty much automatically qualify for an associate fellowship. And then there's add-ons to hit fellowship. And the cool thing about the College of General Dentistry, because I've been looking into it since, I was just making sure it's not a Nigerian prince offering me letters after my name. The cool thing is you can do it many different ways, by publication, by having been a practice owner for 10 years, by, it's not just about clinical and it's not just about other things, which is really cool. So that's been my week.
Sounds like a good busy week.
A good busy week.
So the voice you heard at the beginning there was Adam Govani, who comes from a family deeply rooted in dentistry, with his father, Amin. Is it Amin? Amin? Amin Govani, owning Manor Dental Centre in Leicester. Adam's journey, however, took him to Madrid, where he studied dentistry before returning to the UK in 2019 to practice alongside his father. A journey we're excited to explore today. His professional interests include orthodontics, cosmetic dentistry, and implants. And like Ali, he was a finalist for Young Dentist at the Private Dentistry Awards.
Makes a mockery of the word young, doesn't it?
Beyond dentistry, Adam is also working towards his private pilot license. And you can follow his journey on Instagram. There were some very cool videos I found there.
Oh, thanks.
So, thought we'd start. So, what drew you to study sort of dentistry in Madrid?
Well, it I'd like to say it just sort of happened, but I initially actually started my journey in Prague, or just outside of Prague. So it was, getting down to the final bit of my A-levels. I was having a look at the options there. I didn't get in the UK on the first round. It was either reapply, wait a year, take a gap year. But I saw Dad working, I saw how hard he was working, I saw what he was doing, and I just really wanted to get the journey started. So, I was moping around the house, thinking, I'm not going to be a dentist, what shall I do? I'm a failure, guys. I tried, I failed. But I ended up just on the computer looking. I found study in Europe, so I ended up doing an entrance exam for Prague, where I went along for the day. I hardly remember the day. All I remember is getting back into the car, and I said, Dad goes, so what did you choose? And when he says that, he already knew, he'd done his research, and at the beginning of the exam, you have medicine, dentistry, and you just have to put a cross next to which one you want to do. And then you do the exam. So it's the same exam for both. And I said I chose dentistry, and he goes, what the hell's wrong with you? You could have been a doctor, and you chose... What possessed you? And I said, well, I always wanted to be a dentist, and I ended up getting in. So I went out to Prague, and I was there for about a year and a half. And I found it extremely difficult. I mean, I was just turned 18 and I'd left home. I was in a new country, I was studying, and it was rigorous. It was hard. I thought I knew studying, and I didn't. I was learning how to study all over again. And it was, assessments every week. You failed an assessment once, you had one other opportunity. Anything, you failed the year. If you missed one credit, you failed the year. You had to retake that entire year. And I was on my final chance, I remember, with preclinical dentistry. I'd passed everything else. And it was the following week, the retake. And it was just, the examiner goes, yeah, you're going to end up retaking the year, but it's not happening for you. And it was because I misidentified what a Schlemmer instrument was. That for the lower root forceps, we call them criers. I didn't know what the technical name for it was. Anyway, I went over to Madrid to see a couple of friends who'd transferred there, and they said that they really, they loved it. Do you want to come and see the campus? I said yes. I went in to see the campus in Madrid. I had a look at it. I went straight to the building, and I said to the admissions, I said, where do I sign up? And by the time I should have been doing the retake, I'd already transferred to Madrid, and I continued my journey there. And it involved a very awkward phone call with Dad saying, by the way, I've been studying in Prague, I'm actually changing to Madrid. And are you okay with that? And he goes, look, are you actually going to do this? Are you going to qualify? Are you going to actually put everything into it? I said, I promise I will. I love it there. It looks amazing. I'm ready to go. And from there on, it just happened. So Madrid was incredible. I loved it, and I recommend it to absolutely everybody who asks. So it was, incredible.
Were there language barriers at either university?
In Prague, yes and no, in the sense that it was all taught in English, and in the clinical years you would have a Czech student who would work with you, who would do a lot of speaking with the patients. From what I understand, I didn't actually get to the clinical year there before I moved, but having spoken to colleagues, that's how it worked. They would give you classes in the Czech language, and a lot of people did pick it up very, very quickly because a lot of importance was placed on the language. But in Madrid, I remember it was probably slightly more initially for me. I started living in the residences at the university, where I was probably one of the only international students, or one of the only English students in the building. And a couple of my first friends there, I remember sitting there by myself having dinner, and a couple of guys just said, look, don't sit by yourself, come and sit with us. And these guys were from Seville. And spending a lot of time with them. yeah, they said, don't sit by yourself, come and sit with us. And it became very evident very quickly that I would need to learn the language to be able to speak to people locally. And that drove me to start picking up extra classes, spending more time with the Spanish people. Going further through the university though, so when you get to about third year, you've got to be at a B2 level, B2 level equivalent of Spanish in order to proceed through to the clinics, which is not impossible, but it does require some work. Me personally, I went in not knowing any Spanish at all, and I left having spoken Spanish pretty well. So it was a great thing to pick up alongside dentistry.
So, sorry if I can ask, the pressure. It's clear that you and Dad had a close relationship, and that because of the career progression, his opinion meant a lot. Was there an involvement in terms of, because I'm guessing it's not like a university here where you can just take out a loan and pay student fees. He was also then maybe funding all of this?
Absolutely, yeah. Hats off to Dad. It does require private funding. There is no student loan per se at all. As far as I'm aware, they didn't offer any scholarships. If so, I obviously wasn't able to apply for them. But in terms of the funding, yeah, it is private. It's a private university, and it's not cheap. But in terms of the return on investment, I would say again, it does work.
In case anyone listening is considering this, Adam, because I was an international student in the UK, and my preclinical years, which I did a foundation year at Cardiff, and then year 1 and 2, I believe, no, maybe just year 1, because year 2 they count as clinical then, was about £12,000 in fees, and then clinical years went up to 25,000 a year. So yeah, Oof. Yeah, and so when the local students, I think the Welsh students were paying
3,000.
Yeah. I think in my year it was 1,200 for the Welsh students and 3,000 for the British students. How does that compare to fees in Madrid and Prague?
So in Prague, it was significantly cheaper than it was in Madrid. I believe it was probably, you're looking at about, I don't want to misquote, when I was studying, it was probably between 5,000 and 10,000 a year in Prague. In Madrid, you're looking at 10 to 15 a year.
Okay, so Dad had to change his financial plan.
Yeah, it would have been a bit of a change in budgeting. But in terms of the living fees as well, they were significantly cheaper in Prague compared to in Madrid. So not just the university fees, the living fees themselves, as opposed to paying 800, 900 euros a month in rent, you would be paying 200, 300, 400 euros in Prague. So a massive difference. Which is why the conversation with Dad was a little bit awkward. But in terms of preclinical to clinical years, the fees were the same. There was no change in fees because not only was the university clinic also charging patients for students to see them, it was subsidised, but the system in Spain is significantly different. But the student fees were the same, if not slightly less in clinical years, because you had less theoretical subjects and you had more clinical-based subjects, or more time in the clinics.
Sorry, I was going to say, what is the system in Spain then, sort of, with dentistry?
It's majority private, very much insurance-based. Obviously, they do have a social, structure in place, mostly for children. I think it's under 16s and emergencies. Other than that, you're paying. So it has become very much a private-dominated market, with insurance companies really picking things up there.
You're now involved, which I'm sure we'll talk about, in education, and you're doing some really cool stuff clinically. And how much do you think is attributed to the quality of education abroad versus the UK? And how much would you attribute to the difficulty of your journey and how it shaped your character?
I think in Spain it was probably the same as what it is in the UK, which is you take out what you put in. If you're not going to go out there and actually put the work in, you're going to receive very little. The culture in Spain, from what I remember with a lot of the professors that we had, who are still some of them very, very, very close friends now, which is incredible, and we still speak very regularly, is the way that they really push you to explore, to try and bring about a little bit of innovation. They want you to do more. They don't want you to stick to the confines of regulations. Be safe. Follow the theory, but see how you can improve. Don't always stick to what you know and don't get comfortable. And they were doing that during our clinical years. So we would have scenarios where patients would come in and they would have so many things going on. And they would just say to you, what is it you think? What do you want to do? Where would you start? If this was your family member, how would you proceed? And it became very exciting to be able to start planning these cases. Now, how did that affect me when I came back? Well, I did my DFT year. So I did my DFT year, which was cut short via COVID. And I started triaging like the rest of us for about 2 months from home, which was a pain. But it really got me thinking about how we could bring that mentality here and how I could then apply that mentality and start treating my patients. So I think it's not been easy working with the culture that they have in Spain and trying to bring some of that back, having learnt that predominantly private dentistry, patient-centered focused dentistry, and bringing that back here and focusing on patients as patients, not numbers. It's been quite interesting to see how I can then start to develop. So it's been an incredible last, we're looking 5 years now, of just really pushing to see what we can do next. And having Dad there is incredible. Having that plethora of experience behind me gives me a certain amount of confidence to really just say, right, I can consult you. You're going to tell me when I'm being a little bit too excited, pull me back a bit, say, look, try this first, see if it works. But yeah, it's been wonderful. It's been incredible.
What are some of the barriers you faced in trying to innovate? And give us some examples of what you've tried to innovate with. This is really cool.
So I think a lot of it now, I would say more recently, something that I can really pick off the top of my head is probably when it comes to implant dentistry. So I have worked with a few different systems, and I was fortunate enough to attend a day I think it was in Coventry, where I was having a look at the magnetic mallet with Sweden Martina and how you can apply that in the use of application of implant dentistry. So without the need to use drills, without the need to go into denser burrs, which are fantastic. I know, Ali, you like those. And they're brilliant. I love using them. I've used them in Albania when I was with Megagen. But in this case, just the magnetic mallet, just to be able to create an osteotomy, internal sinus lifts. You're looking at 5 mil plus internal sinus lifts using this and getting really predictable results. Taking type 3, type 4 bone and making it a little bit stronger. There's nothing worse than getting in there after looking at the CT and thinking, yeah, I think this will be okay. The moment you get past the cortical bone and you're just in styrofoam and you're going, what am I doing? How am I going to get any sort of stability here? And you've got a patient with an upper one going, are you going to immediately load this for me? And I'm thinking, no. But with the magnetic mallet, what I've been able to do is I've been able to actually create osteotomy sites, and I've been able to place implants, load them immediately in areas which are post-extraction sockets with upper sixes, with very, very, very small septums. And we've been able to use that septum, manipulate the bone and get implants in. And I think the first time I did it, I remember my dad had a bit of a head cold and he wasn't in. And so it was just me, and I was in this room actually, and I had 2 nurses with me. I had all the kit out and I thought, right, I'm in my element, let's do this. So I did it, I took my PAs, everything was fine, patient was happy, sent one away. I was going to see her in a week, and when I got home and I was just flicking through the photos and I was showing Dad, I was like, what do you think of all of this? And he's going, you're absolutely mad, what have you done?
What on earth have you done?
When he looked at the data, when I showed it all to him, because after the meeting that I had in Coventry, I brought it all back, and what I realised was the dentist that was actually teaching that was from Italy. And again, another country where they love to innovate. There's just that, what can we do? How can we make life a little bit easier? What can we do to really make the areas work for us? So I think the red tape will probably lie mostly in me doubting my own abilities a little bit, because again, fresh off the gates. 2, when you have got mentors, it's perfect because they're giving you a controlled environment to be able to actually work. They're giving you the information and they are watching you as you're going. But when you bring something new to the table and the mentor's a bit, no, I don't know about that, so you're going to have to tell me. So then it becomes a little bit more dicey. But at the same time, when you've got all of the information, when you know clinically how to apply it, it becomes quite easy to do. So now I've done over 20 cases using the magnetic mallet alone, no drills, from initial through to end, through to placing the implant. And it's been a game changer for me. Do I use it every time?
Really
No.
cool.
I don't use it every time. But there are certain cases where I'll say, bring me out the magnetic mallet, and the girls are going, oh my God, we've not got it ready. So yeah, mid-surgery, that's not what they want to hear. So it's definitely just about trying to really make practice more enjoyable, but at the same time, make patients more comfortable, make my cases a little bit more predictable. And let's see what's next.
Really cool, Adam. Where did you get exposure to implant training as an undergrad, or is that stuff you've done post-grad?
Great question. Yeah, it was as an undergrad. And again, it was about, if you don't put the work in, if you don't go out there looking for it, you're not going to get it back. So when I was in my second year of clinical year, so I was in my final year, and I had an opportunity to go, like the other students, nobody was excluded from this. You had the opportunity during your own time to go and spend time in the master's clinics. Now the masters at this university in UEM, you're sinking about 50 to 70,000 euros a year to have the opportunity to go and study oral surgery and implant dentistry there, or periodontology and implant dentistry, whatever it is you want to do, prosthetics, the rest. And I was going 2 or 3 times a week. And I was spending time with the implant dentists, I was spending time with the prosthetics, I was spending time in the restorative dentistry department just to see how they do things. What's their setup like? How are they treating patients? How are they treatment planning? And then towards the end of the year, it was actually the day after our graduation party, which I was involved in setting up. I had to drive up to the north of Spain, and I spent time with Eduardo Anitua from...
I love it at BTI. Yeah, incredible place.
Dad met me there. I drove up, we met there, and we had a great week there with Anitua, and it was incredible. Not only did we get to see Rafael Nadal just walking through the building to get his PRGF injections in his knee or his shoulder, one of the two.
It was his knee, yeah.
Yeah. And we saw him. He was there, and I was like, "Can I get an autograph?" No. Can I have a photo? No. Leave him alone.
And Anicha always mentions Nadal in his lectures, but I can't believe you actually bumped into him there. That's amazing.
Physically there, so it was awesome. But at the same time, it was eye-opening to see again just how they work clinically.
Yeah.
It was an atrophic maxilla portion of his course, and I was there for a week watching him deal with atrophic maxillas. And I'm thinking, this is way out of my depth. I've not even fully qualified yet. Like, I'm waiting for my graduation day, but I'm still a student, and I'm here with these dentists, with these implant surgeons. Kai Zwanzig from Germany was there, and he's incredible. His cases are awesome. And I was sitting next to him. We were both learning from Eduardo Anitua. So to be able to be in those sort of rooms and to be learning around those sorts of people and taking from their own experiences has been incredible. And it goes to show that, yes, the UK has some incredible clinicians, arguably some of the best, but having had the opportunity to really get that experience from outside as well into the European Union has been, it's been awesome.
That's incredible. I mean, how many UK qualified dentists would say that as undergrads they got enough to come out and be practicing implant dentistry, and not just practicing, but to be innovating in implant dentistry? Incredible. Adam, a case of yours was shared by Zero Bone Loss Concepts recently, and I made you promise that you would open up about that today, because I've been waiting to hear about it. Yeah, it was a pinky promise. I made it sound like a threat, as if I said, well, just so the listeners know, basically last week we were meant to record this podcast, and Adam's little one was ill, and he messaged us, but neither of us saw the message, and we came here and we got all set up, and he felt really terrible about it. So I used that as the opportune moment to say, Adam, no problem, we'll reschedule for next week as long as you do this. Now the thing is, he's doing us a favor coming on the podcast, so I made it sound like I was leveraging something. But honestly, it's because I've been so curious. So you've had some success with getting I don't want to say this wrong because it's easy to look at an X-ray and see something and misinterpret it. But it looks like you've found a way to regrow bone in some cases around implants with issues, and it's the reason this is really cool is because you shared a case and the team at Zero Bone Loss Concepts reshared it. And so it falls within their principles, which are biological principles, which is moving away from the world that is massively industry sponsored, where, cowbone sponsors everything. So empires are built on cowbone. So please talk to us about this.
So it was interesting because no grafts were used. It was no membranes, no connective tissue grafts. So I wasn't cutting into anybody's palate. It was very much a case of having a look at where the implant was, first determining, is the implant position favourable? Yes. Is it deep enough? Yes. To what are the limiting factors? So one, was it the oral hygiene? Well, the oral hygiene was spotless. The patient was cleaning really, really well. So then what else could it be? And it was the restaurant.
And sorry, what was the issue? Because what was the issue that you were trying to get to the bottom of?
The issue was that we had a massive amount of bone loss on the mesial side of an upper six. It was just huge. I mean, I think if we'd left it that way, it probably would have stayed, but it would have come with a lot of defects later on. It would have been very, very difficult to save later on. And it was down to, number one, the amount of bone that was lost, so vertical bone on one side. And when it's a horizontal problem, normally we can deal with it, collectively. With this, it was just a really, 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 really deep amount of bone loss. You're looking at about 6 to 7 mil just lost in the space of 2-3 weeks. It was incredible. So then having a look at it, we said, right, we can graft it and then we can literally just bury it and just let things settle for 6 months and see what happens. Or we can do something slightly differently. So what it was going back to temporaries, doing a temporary abutment and literally shaping the emergence profile using composite, just using flowable composite, building up a little bit of a contact point with the teeth on either side, and then saying, right, now we've got enough space to allow things to develop on either side of this implant. That, along with a little bit of laser as well, so I like using the water laser, the I+. That was really great to be able to just really scale everything out without needing to be too damaging to any implant surfaces.
So right into that vertical defect.
Yeah, allow it all to bleed, allow the bleeding to really, really just fill the area up. And it was just simple sutures on either side, just on the papilla, really nice and loose, nothing too tight. And then I reviewed it in a week, I reviewed it 2 weeks, I reviewed it at 1 month, 3 months, and I just started to notice bone was growing over this implant. Within the space of 6 to 8 months, I had bone over that implant. And I went, this is awesome. This is great. This is just because of how we decided to shape that, make sure that we encouraged bleeding, made sure that we got rid of as much gunk as we could under the gum. Like we said, the oral hygiene was fine. It wasn't a problem with the fact that she wasn't cleaning. And then we have a look at the history, and there was a vertical fracture through the upper six prior to the implant placement. So there could have been some amount of trauma there. It could have been trauma when the roots were being removed. It could have been remodeling. There were no problems with the 5. There was no problem with the 7. But on the mesial aspect of the 6, it was so deep. And I was going, what is going on? What are we going to be able to do here? You're not far from the sinus. But yeah, it worked.
How long was the implant in before you noticed the defect?
The implant was in for about, I want to say it was 2 months, 2 or 3 months, and everything was stable. And that's it, we started to notice a loss.
So that's really cool, Adam. That it's, to me, it seems like kind of the spirit of innovation that was kind of taught, because it's a mindset thing. It's almost the opposite of UK universities, which is dogma and fear and very rigid clinical protocols, is inspiring you to think outside the box and to try things that are safe but are within the thinking in Europe, really, and you're able to do something that is so much more conservative than what would be acceptable here.
Yeah, I think it's I remember during the foundation year, I think one of the first meetings that we had as a group was actually with the GDC to talk about what is expected of us, how we can work together. And everybody was getting a little bit, well, oh my God, like, what are we going to be taught here? What are we going to be told? Are we going to, how is this going to work? But what I actually took away from it was that, be safe. It is patient first, which is everything that you're taught in Europe. Apply your knowledge correctly, which is what we're told in Europe. And should something go wrong, take onus of it, duty of candor, move forward. How are you going to resolve it? If you need help, ask for help, refer. So nothing along the way have we done anything where we've gone, no, we're reaching here. We're staying within the rules of what we should do, but we're doing our best to try and say, right, we know this, we understand this concept. How can we apply it to make sure that this works? There's not enough space, let's give space. And that's exactly what we did with the temporaries. And when I saw bone was growing, I was blown away. The amount, how quickly it all happened. And then I started sending it out. I sent it to you. I sent it to a few other colleagues, Ali, and the response was, okay, tell me more.
I was like, tell me your secrets.
So then I said, right, I've got another couple of cases. Let me see how this works. Now, in a couple of cases where, there have been other factors, oral hygiene, etc., there have been cases where implants have been lost. And in those cases, we've had to manage those sites. We've had to explain, and other implants have gone in, and they're working absolutely fine. So, is there a real... can you paint all of them with the same brush? Absolutely not. But this was just a case where I was really happy. Have I had others? Yes. And I think we will continue to. So hopefully, as we just really tweak things, we'll have a timeline into when implants should be placed post-extraction. Are they going to be immediate? Are they going to be delayed? Are they going to be, sort of either short-term or long-term delayed? And then once we've got that, then let's see where we go. But it's going to be using the instruments that we use. It's going to be using the systems that we use, and it's exciting.
It's really cool. You took a resective approach, in using the laser. You went to restorative principles and biological principles rather than surgical principles, and you got a regenerative result. And that's kind of that's what we. The idea more and more in implant dentistry is that if you stick to the biological principles, things will be okay. And it's really cool how you got your mind around that. And I'm kind of, one of the things Flo and I were talking about is, when we discuss these things, you're always humble about things, but you're doing really cool things, and you're involved in so many different parts of dentistry. And the question was, where has that come from? And I think it sounds like your undergrad was a big part of it, but talk to us about your involvement in Totally Aesthetics.
Yeah, so Totally Aesthetics was something that just, I think, I remember going to Totally Composite in Belfast. It was during the COVID time, just after my DFT year, and I flew out. We were locked in a hotel, and I was basically just there in the hotel after the course day one with all this information from Monic, and we were sat there, we were just having a conversation, because I was fortunate enough to be, one of the only guys that came over from England. Nobody else bothered. It was COVID. You'd have to do that much pre-prep to be able to travel, to basically spend all this time in a hotel, but had quite a lot of time to just go through, ideas with Monic and see the way that he likes to approach things. And it very quickly, actually, it was that day one. It was after day one, and we were talking, and he was talking about Totally Aesthetics, that I signed up to the program there and then. And that's it. I said, right, I'm in my infancy. I've got my mentor, I've got my dad, but this is a really structured, well-structured program towards aesthetic dentistry, but it encompasses everything in this postgrad. You're going through, from endo to perio, the lot. And it gave me a really good insight. Some incredible mentors, Sanj Banderi with endo, Ian Dunn with perio. You've got all these awesome guys there teaching you such amazing things geared towards aesthetic dentistry, which is something that I was very interested in. And then afterwards, I remember my wife wanted to go on the program, so we said, well, let's do it in Ibiza. Let's make a trip out of it. So we went to Ibiza, and I ended up helping out on the course voluntarily. And then the next thing I know, Monic said, do you fancy coming down every now and then and helping out on the course, and it was incredible and really quite, I didn't expect to be asked to help on that course straight away. It was quite a shock to me, but it was incredible to go there and to be able to help out and become a clinical instructor within Total Aesthetics, and meeting such incredibly talented dentists on the program, coming in and doing awesome stuff at the same time as, being able to, sit alongside people like Ian Stewart and talk through things from perio to implants with the delegates. It's been awesome, and picking up things along the way, as well as being able to help out younger dentists, or maybe not even younger dentists, but dentists who really want to get in and do this sort of work. So yeah, it's given me more of a push, I think, because I expect a little bit more for myself every single time we go. I think, actually, I could probably do this now, whereas prior to that I'd be thinking, actually I'm not quite ready, let's maybe push that off, or I'll give that to my dad to handle and I'll carry on with what I'm doing in my room. So it's been awesome, and Monique and the team are incredibly, they're incredibly helpful. They're really, really, really motivating, and they, there are times where I'll send cases to them and I'll say, what do you think? And they've always got time. So it's
I have to say, we're all alumni of Monique's courses. Yeah, I have to say, I've probably said this before, but I think I always feel the need to say this because I owe it to Monique to say that Monique's course, I did Totally Composite in 2015, and it changed my career completely, because I came back from Monique's course and I said I have to use rubber dam for every single composite, and for a year I did, and I'm not doing composite anymore, but what it taught me is standards. And everything changed by applying these standards that Monique taught, and coming away from it with the mindset that I'm going to approach every single case in a protocoled way to these standards. And that kind of changed the trajectory of my career. And I think there was something about Monique that it was a really inspirational, supportive setting. And I think that's why I think it's really cool that it's all the people that you mentioned. Stuart, I know best because we're in the implant world together, but I just think it's an incredible setup. Did you find the same thing?
Oh my gosh, yeah. I mean, yeah, the support on the course, but it was really inspiring, and I think also like everything was put in a way that it felt like you could do it. And definitely been on courses where they sort of make it sound quite difficult, and then it sort of puts you off trying. Whereas everything felt manageable, and that you could go on Monday and put it into practice, which
I was never amazing with composite though, and some people on the course were. And the cool thing is that I feel like the people who are really, talented with composite and really understood way more going in than I did, they were supported to get to a much further stage in that same course, where I was figuring out, okay, if I'm doing a poster, how do I make sure the bond and the contacts are perfect? These guys were like, wait, my layering needs to improve. So really, really cool. So you're in all of this, you're with all of these people, you've got your practice now for a year?
Yeah, so I acquired a practice in March of this year. So we're looking at about, what are we now, 10 months? 9,
Congratulations.
10 months. Thank you.
So this is an already existing practice close to home?
It's about, I would say about 15 miles away, 10, 15 miles away. So not incredibly far. It's at the north of Leicester, so yeah.
Is there a story behind how you found this practice? Were you looking for a practice at the time?
I've been looking for a practice for about, I'd like to say 2 years. And it was one of those things that happened. We've got some very, very, very close family friends. They came over, as they do normally once or twice a year. They were coming over, and one of them goes, well, they've both got a practice each, husband and wife, and the wife goes, yeah, right, ready to sell. And I went, excuse me? And she goes, yeah. I said, why? She goes, yeah, I'm ready. And I said, you remember you gave me first refusal? She goes, no, I don't. I'm going to market literally next week. And this was on Sunday. I said, right, when are you free? She goes, we can meet Wednesday. I said, Wednesday. And I went with Dad on Wednesday, and we had a look around the practice, and we stood in one of the surgeries. It was actually surgery 2. I remember which surgery it was. It was a very, very pink, it's a salmon pink room. It's an old practice established. It's been there for about 40 years, and it needs a bit of work. But it's an amazing location, amazing practice, amazing people. And yeah, we decided there and then that that's what we were going to do. And I said, yeah, I'll take it. And we shook hands, and that's it. We let everything else fall into place.
So why did you decide that you wanted to have a practice?
I think because it was the next step. I'm doing quite a bit of work with Dad. We've got Manor. This is Dad's. I mean, he where I am now. He established this 8 years ago after selling a very, very, very busy mixed NHS practice and private practice in Leicester city centre. And he set this up actually very, very close to the house. It was actually a quadruple garage, and he just completely gutted it, and he put everything in purpose-built building. And so I've been working with him, and he's got plans to extend and do some incredible things. And I said, great. I said, I would like to have a practice, and I would like to do something as well. And he goes, well, nothing's stopping you. You can stay here working with me. And I said, yeah, I want to. But you've done as much as you have. Let me try and build things up a little bit as well. Let me try and do something. Let's see if it works. I know I can. My wife's a dentist. I'm a dentist. We've got 3 dentists now in the family. Let's see what we can do. And he goes, yeah, sure. Yeah, if it makes sense, let's do it. And it made sense. It's not far away. It has got a small NHS contract, which works quite well to bounce off of each other. And
So Dad's a partner in this?
Yeah.
That is awesome. So Adam, what's in store for Adam in the next kind of 3 to 5 years?
If everything goes well, hopefully quite a bit. I think we've got our task at the moment of renovating the new practice, something I mentioned that we're doing quite quickly now. So we've got plans to gut the salmon pink room. Unfortunately, the pink is going. But it's not. There's no disability access in the practice at the moment, so we're putting in a surgery downstairs, putting a new surgery upstairs, revamping things a little bit, changing the workflow, changing the way that the patient journey, bringing in new roles, making things a little bit more digital, because I do like the digital stuff, as Ollie knows. And I think from there we'll see. I think we've got plans to extend both and expand. And yeah, my wife definitely wants to come on board and start working with us as well. She's been full-time mum at the moment, and she's been doing an incredible job. She's been doing a really good job. She moved over from Italy last year, and having just moved over, had the little one, it's been pedal to the metal for her. Whereas in Italy, she was working 8 a.m. till 9 p.m. days, 6 days a week. I would actually argue to say she's more tired now than she was then she was.
Yeah, being a mom.
But when she does come on board, it's going to be awesome. She brings a whole different dimension in. She did a master's over in Sapienza in Rome in oral surgery and implantology. She's also done a separate one in endodontics. So we've got the microscopes and all of that for her to have fun with. So yeah, lots coming.
Really cool. And actually, that was what I was actually asking, is to see where your mind is, and it's very much on developing your practice and your business along with your clinical work. That's really cool.
Yeah, I think I don't like staying still when it comes to the practice. I don't like it staying the same for too long. I think if you stay stagnant as a business, you're going to die. But also in terms of being able to offer the patients the very best. When the wife, when she went in last year and had our baby boy, the facilities that were there on hand to look after her are incredible. And unless I can say that the facilities on hand to be able to look after our patients are incredible, I just don't think we're doing it justice. So yeah, there's, like I said, there's lots coming, but it's going to be really fun.
I love that.
It's been a fantastic chat there. Before you go, we have a little quick-fire quiz to earn you your dental pearl. There's not an actual pearl. So question 1, what is your favourite procedure to do?
Ooh, favourite procedure? I would say dental implant placement, immediate post-extraction on a Upper right 6.
Ooh, nice.
Very specific. I love
like that.
it. What is your favourite scrub colour to wear?
I'm going to have to go with blue.
Nice.
Very traditional. With no context, which is your favourite tooth?
Upper left one.
Nice. And if you had to start again, what would you like to do?
Career-wise?
Yeah.
Ooh, fighter pilot all day long. No, I think I'd have to go with dentist. I do really love what I do.
You went through a lot to get through to being a dentist, and a lot of resistance, and you'd only get to this point if you really wanted to do it. Amazing. Brilliant.
You can definitely hear the passion
Yeah.
when you're talking there. It's really inspirational.
No. Thank you so much, Adam. Thank you. I love interacting with you. I know we've kind of messaged back and forth over a couple of years over random things, but I think it's amazing how you maintain your humility whilst you're doing all these really cool things, and I think you inspire a lot of people, and thank you for being you.
No, thank you. I have to say, just to finish off, I don't think any of this would have been possible without my dad, without Dr. Amin Govani. A massive shout out to him. I wouldn't have been able to get to as far as I am and continue to keep pushing without him. And then to have people like yourself, Ollie, to be able to really start to pave the way to sort of say this is possible. It becomes very difficult to say where are we going to go next. So a massive shout out to Dad. Thank you to him, and thank you to both of you for having me. It's been awesome.
Amazing. Thank you, Adam.
Thank you.